Okay, hopefully that recording is working now. So thanks everyone and welcome to webinar 2 of Spring Clean Your Way to Better Health. I know some of you were here last week, but some of you weren't. So it's lovely to have some old and new faces. And firstly, obviously I want to acknowledge the traditional custodians of the land on which we Zoom today here in Canberra, the Ngunnawal and the Ngambri people. So just pay my respects to elders past, present and emerging. And also, thank you. Thanks for giving up your time to come to this today and listen to the wonderful presenters we've got. So you'll remember myself and Di potentially from last week. So Di from COTA ACT and Meg is from the Heart Foundation, a colleague of mine. I refer to her as my work wife, which is lovely. That's how close we work together. And she's a dietitian, so I'm going to talk a little bit about nutrition a little bit later. So last week, you'll know we covered a little bit about asthma, the Strength for Life program. I talked about heart health, and we'll probably touch on a few of those things again today. But today we're going to talk about, again, some risk factors for heart disease. But this time we're probably going to focus a little bit on some of the tools and resources that you've got to support you. I'm going to talk a bit about medications, adherence and falls prevention rather. And Meg's going to talk about nutrition and some healthy diet tips. And at the end, as we did last time, we'll have a bit of a Q&A session at the end there. So what have I got? So what you told us, so when you registered for this webinar, you gave us a little bit of information about yourself, and basically we just wanted to know a little bit about you and where we want to put our focus on for these presentations. So basically kind of the fair majority of you felt pretty comfortable about your own ability to safely manage your own well-being and health and fitness, which is really good. And so hopefully for you guys that are here, we'll potentially give you some more tips to get even more confident in your ability. So some of the things that you told us you wanted to hear about. So sleep and heart health, balance and falls prevention. So that's good. Di will touch on that. Meg will touch a little bit on those dietary tips for inflammation, and I'll talk a little bit about different heart health issues, and hopefully we'll touch a little bit on that sleep apnea, back issues and depression as well. Probably won't go into too much detail about it, but we'll see what we can cover. So the things that you guys struggle with, balance, some pain after and during exercise, when doing some of those less fun tasks like vacuuming. I've got some great advice for that. But yeah, pain during standing and walking, which is not ideal, but we'll look at ways to deal with that, and also talk a little bit about weight training and knees. Di or Meg, I'm really sorry. I've just got a crying child at home and I apologise. Is there any chance you can just take over for one slide and I'll just duck off and come back? I apologise.
That's fine. I'm happy to take this one, Robin. So again, this is based on your feedback when you all registered. So in terms of some of the barriers, and you spoke about, stress, chronic health conditions, and, very understandable given the relentlessness of some of them. Fatigue, mental health, which is probably particularly big at the moment. Time management and prioritising, motivations, weather. Hopefully we're coming to the tail end of the freezing cold weather. Cost and discretionary food. So all very common themes, I think, amongst this group and many others, but hopefully we can tackle some of those today or give you some other tips or tricks as to how to combat these.
Thanks, Meg. Sorry. So we covered this a little bit last week. I'm going to dive into some heart health stuff and talk a little bit about those really great behaviours to, protect your heart. So I'll just quickly go around the 10 steps again for those of you who weren't here last week. So, these are just behaviours that you have control of and that you can do to try and reduce your risk of heart disease. So obviously moving more, and Di spoke about that last week, and I spoke about that as well in regards to our Heart Foundation walking program, which is a great way to get yourself to move more. But I guess the biggest takeaway from that is, you know, anything is better than nothing. So moving a little bit is better than not moving at all. Being smoke-free, maintaining the healthy weight, limiting your alcohol, and I imagine Meg will talk a little bit about that later. Reducing your stress, managing cholesterol, so really knowing your numbers, knowing your cholesterol, blood pressure, and you know your blood sugars and what is normal for you is really important. And seeing your GP for a heart health check and following that heart healthy eating pattern, really important. So some of the risk factors for heart disease, so these are the things that have an impact on your risk, and the majority of these things you can control, but unfortunately, you know, your family history, your genetics and your age, you can't control as much as we'd like to, but we can't. But some of the things that are on this slide you can control, and those are the things we want you to be aware of to try and reduce that risk. And so I think the only one that we haven't talked about on there is the kind of mental health aspect. So I want to talk to you a little bit today about, so we talked about last week about the risk factors and what you can do. I want to talk to you today about some of the tools and resources that you've got available to you to be able to, you know, better manage and know where you kind of sit in regard to your heart health. So a couple of years ago, the government, after a bit of a push from the Heart Foundation, brought in an MBS item to cover something that's called a heart health check. It's a 699 number, and if you duck off to your GP and ask them for a 699 heart health check, you should be able to get that pretty well covered under the MBS. If not, then maybe a small gap depending on your GP. But basically that's a 20-minute checkup with your GP to assess your risk of the likelihood of you having a heart attack or stroke in the next 5 years. So you don't have to get on a treadmill or anything. Your GP will check your blood pressure, cholesterol, and blood sugar levels. And I'll talk to you a little bit about some of those risk factors I talked about on the last slide. And then what they'll do is they'll put all that information in an online calculator, which will then give you a result, so a percentage risk of what your risk is. And then once you get that, you'll be able to talk to the nurse and the GP and potentially put a plan in place that's, you know, to better manage your risk, which might include, you know, some behavior changes or medications. So I've just got a little animation. Hopefully it'll work. Sorry, it's taking its time loading.
Heart disease is the leading cause of death in Australia. Many people may not know their risk of developing heart disease, especially since you often can't feel risk factors like high blood pressure or cholesterol. The good news is that common types of heart disease like heart attacks, as well as strokes, could be prevented through regular heart health checks with your GP. If you are 45 and over and do not already have heart disease, you are eligible for an annual heart health check under Medicare. Aboriginal and Torres Strait Islander peoples are eligible from 30. A heart health check is a checkup performed by your GP that helps you understand your risk factors for heart disease and estimate how likely you are to have a heart attack or stroke in the next 5 years. Don't worry, you're not going to have to run on a treadmill or have any surgical procedures during this visit, and it only takes about 20 minutes. A heart health check usually involves having your blood pressure, cholesterol, and blood sugar levels checked. You will also talk about your medical and family history, as well as your lifestyle, what you eat, how active you are, whether you smoke or drink alcohol, and if you are maintaining a healthy weight. Your GP will estimate your risk by putting this information into a calculator and will let you know whether you are at low, moderate, or high risk of having a heart attack or stroke in the next 5 years. Your GP or nurse will develop a plan of short and long-term steps to help you lower your risk of heart disease, like ways to be more active, quit smoking, and maintain a heart-healthy diet. They may also refer you to a dietitian or prescribe medication if you are at higher risk. Keeping your heart healthy, whatever your age, is the most important thing you can do to help prevent and manage heart disease. Take the first step to protecting your heart by visiting your GP for a heart health check today.
So I probably won't go through this slide, but there's a little bit of information on our website about it if you want to know more about that. But yeah, basically every 12 months, anyone 45 to 74, I think it is, without already existing diagnosed cardiovascular disease is eligible. So yeah, we want you to get into your GP and go and have a heart health check. So if you can't have a heart health check or you don't want to do that, the other thing that you can use is our heart age, basically an online calculator, and you pop in a whole bunch of information, sort of like what you would do at your heart health check, but just a little bit less, clinical. You pop in all the information that you know, and then it will give you a bit of a calculation to show whether your age is, if your heart age, for me, I'm 42, hopefully my heart age is 42. But so if it's above, that's probably when I need to be going in to see my doctor to talk about that result and really start the conversation about heart health. So that's essentially what that calculator is aimed at. The last thing I wanted to talk to you a little bit about today is the warning signs of heart attack, and just knowing, I'd love to say I've got time to have everyone chat about it, but we don't today, unfortunately, because it's only a 15-minute presentation from me. But what we want you to just all be aware of is, some of those really typical signs of heart attack, but then there's also those atypical signs. So the things that don't happen quite as often as, that chest pain and stuff. So we talk about, chest pain, neck pain, jaw, back, arms, dizziness, lightheadedness, and feeling faint or nauseous. That feeling of indigestion or, wanting to vomit or vomiting, and obviously shortness of breath. And another one of the less known warning signs is sweating or a cold sweat. So if you're feeling any or experiencing any of those symptoms, we really want you to be calling 000, particularly if they persist. And, we know people aren't keen on calling 000 because they're afraid to, they don't want to burden the ambulance staff, but really, it's more than just a taxi service. Don't have your partner drive you to the hospital. Just call that 000 where the ambulance service can actually, start administering some help and some medical, techniques to help you with that. I've got another video, but I'll actually flick over it because it's 3 minutes long and that's going to take too long. So the last thing I want to talk to you about is medications. Sorry, I forgot about these. So, my partner's a pharmacist, and I always hear him talking about people, kind of not taking their medications correctly. And, I don't myself. We all think that, we feel better and, oh, this is fixed, so I'll stop taking it. But really, what we need to be doing is taking our medications as prescribed. So even if you're feeling well or you feel like whatever the ailment is that those meds are, helping, you need to make sure that you keep taking the whole run of those medications. Sorry about my children. So we know that each of the medications can help in different ways. So you really want to be talking to your pharmacist or your GP, when you're introducing new medications or changing something or, grabbing something from over the counter. Really good to obviously be aware of what you're currently taking. And if you know how to, you could use the Medicine Wise app. You could have a little card in your wallet where you, jot down all your medications, what you take and what you need to take and when. Obviously really important, like don't crush your tablets or break them up or take half, like just take them as prescribed. The other good thing you can do is set a reminder or use a chart that helps, and maybe in the Q&A later, if you guys have some good ideas or reminders for how you keep on top of that, we could talk about that, which would be really good. And the other thing you can do if you've got any issues is call the MPS Medicine Wise line with questions that you might have. So the number's there on the slide, and we'll send these slides out after so you've got all that information. But yeah, obviously talking to your GP and pharmacist is the best place to start if you've got any questions. So what I'll do now is hand over to Di, who's going to talk to you a little bit about falls prevention. So thanks, Di.
Thanks, Robin. And look, if anybody's got any questions, just pop them into the chat and we can get to those at the end of the 3 sessions. We should have about 10 minutes at the end. So if there's any questions about Robin's presentation, just pop them in there. Thank you. So my presentation's about falls prevention. And I just want to thank everyone for coming along today, and also to Meg and Robin for joining me. It's been a pleasure to do these 2 seminars, webinars with them. And there's lots of important information. I think the hardest thing for us is that we've got about 15 minutes. We don't want to overload, but we also want to give you some really key information that you can go away with. So my role is Active Ageing Coordinator at COTA ACT. I'm also the Strength for Life Coordinator, and I instruct classes at the Hughes Community Centre under the Strength for Life banner. So I'll be talking about falls prevention and the important role of exercise, and in particular progressive strength training in our lives, as well as the Strength for Life program, which we touched on last week. So I'll do a little bit less on that bit, but enough so that the people who didn't attend last week's webinar have got a good understanding of what it is, and also about the Strong Women for Life project, which we've just started up. So as I said, please feel free to pop any questions in the chat as we go along. So what is a fall? The description of a fall is landing on the ground or some other lower surface when you didn't intend to be there. So that also includes slips and trips. And most falls result from a number of risk factors. So the physical risk factors are maybe changes in your body that increase your risk for a fall. Could be behavioural risk factors, things we do or don't do that increase our fall risk. And our environmental risk factors, so maybe hazards in the home or in the community. We talked last week about the bike paths and that, or the shared walking bike paths, and sometimes those uneven surfaces can be an issue and increase our risk. So you might want to have a think about those 3 categories and what might be influencing your particular risk or the risk of somebody that you know. So we've got the physical risk factors, the behavioural, environmental. So if you can think of one thing, just pop it into the chat. And I don't have my chat box open there, so maybe Meg, if you want to, oh, hang on, I'll pop it up there. There we go. Any ideas? What happens to us physically that might increase our risk? Could
What
be
about losing strength, Diane? Does that fit into one of those categories?
Definitely. Frailty can increase our strength. So loss of muscle mass and muscle strength. Might be having arthritis in your knees and finding it very difficult to walk without pain could increase your risk.
Someone's mentioned dizziness, Di.
Dizziness, definitely. You know, we've got clients in Strength for Life who suffer from vertigo, and there's periods where they feel very unsure on their feet and even not able to do any exercise. They need to stay at home and sort of medicate and let it pass. But what if they're going out to the shopping centres and wanting to buy their food? Or, you know, there's a risk there, isn't there? Definitely. And, you know, we're talking about frailty, behavioural risk factors is the things we don't do. So there, we'll talk about exercise a little bit later, but they're very closely linked, is our activity levels and our falls risk. So are falls preventable? And many of us kind of want to know, how are they preventable? How can I do it? And the simple words, she fell, can have a huge impact on us. We all know someone who has had a fall and experienced significant life changes. But are they preventable? And if they are, maybe you could pop something into the chat of some of the things we could be doing to reduce our risk of falling. So the risk factors, we've always got the things that we can't change, but there are things we can change. And the risk factors that we can't change is the fact that we're getting older. But it doesn't mean that as we get older, our risk increases. It's just about how are we managing those risks. Our gender and our ethnic background are things we can't change. And I think we're all challenged to try and improve the risk factors that we can change. So we can become more physically active. We can be including strength-based exercises in our routines. We'd have the home environment evaluated and getting things fixed. We could get our annual vision checks, making sure our eyesight is good and we've got the right glasses or contacts so we see well. We make sure our medications are reviewed and considered for fall prevention. And if you're taking 5 or more medications a day, you have a higher risk of falling because of the number of medications that you're on. We can deal with the fear of falling through education, especially using evidence-based falls prevention programs. You know, there's another program called Stepping On, which is a great program for falls prevention. We assess, we can increase our social activity, being more socially connected, going out and seeing people, being a bit more active. I think they're tied together. And we can exercise and improve any weak muscles and focus on our posture. And for some people, we can learn how to use assisted devices that are fit to us and to use them right away. And we know there are a lot of people that maybe hesitate to use an assisted device, but that's another way that they can minimise their risk of falling. So I put this in last week, but what I've done here, it's specifically for women because of the project that we're doing at the moment. There's not a big difference between the results from men to women. I think the women are at slightly higher risk. And this is about how many people who did not do the recommended 2 days a week of strength resistance training per week. As you can see, there was a large percentage of women who did no strengthening exercises in their week, and there was a small percentage that did 1 session a week. And you've got 3 different columns there, the age ranges. So 45 to 54, 55 to 64, and 65 and over. So we're not doing as much as we get older, but in saying that, we weren't doing a lot anyway. So what is the progressive resistance training? It's a type of exercise where participants exercise their muscles against some type of resistance that is progressively increased as the strength improves. So using body weight, bands, dumbbells, weighted equipment. And that's where the Strength for Life classes have come in really handy for a lot of people, because that's where you can get that strength training. So the Strong Women for Life project, what we did is we received a Women's Safety and Participation grant for a project called Strong Women for Life. It aims to support older women to improve their health, their strength, their balance, their fitness, and reduce the risk of injury or serious injury from falls later in life. It is a prevention project, so we're aiming to help women stay healthy for longer as they age, and also instead of doing these falls assessments after many falls, is that we're trying to prevent those falls or serious falls from happening before that. So we're using the funding to enhance the Strength for Life program. We've got a falls assessment module, and the focus is for women over the age of 55. We're also developing an online library of exercises and stretches to support participants' ability to exercise safely and safely at home. And we currently have funding to cover the cost of 20 of those falls risk assessments for the new Strength for Life participants. So what will we do? I think you're ahead of me there, Robin. So what will we do? We'll do the falls risk assessments. And that is in conjunction with the regular Strength for Life assessment and the program design. We do an individualised program design for every participant before they start the classes. The clients will participate in either 1 to 2 classes a week, and then we reassess that Fallscreen assessment after 12 weeks, hopefully seeing some amazing results. And as I said, we've developed those exercise videos for home support. And we're hoping to integrate the Fallscreen risk assessments as an ongoing service, so people could come in and do the falls risk test. They're not necessarily joining Strength for Life. They might be going off to a yoga class, but that might be a really good way for them to assess, well, what's the benefit here of me doing that particular activity? Am I getting stronger? Is my falls risk lowered over time because of what I'm doing? So for those of you who don't know what the Fallscreen test is, it was developed by Neura in Sydney. And so we've got all the testing equipment, we've got the software to analyse the results. It takes about 20 to 30 minutes to do the 5 tests, and there's no referral necessary. We're doing the tests at Hughes at the moment, but we're looking at other locations in the future, maybe one on the north side and one on the south side. And then what you get from that those tests is a result. It results in an overall either low to high risk score, and then also you get the results for each individual test. So you can sort of see, what did I do well at, what did I do not so well at? And then for the instructors, it's a really good way for us to go, okay, if that's the case, if your leg strength of your age. And, you know, we're talking about the Women for Life project, but Gary, I'm just going to let you know, it's for men and women. So we're not being too exclusive here, but in relationship to the project, it will be the women only. So if you had lower leg strength, we're looking at, okay, what exercises will we put into that person's program to help develop that leg strength that they need and then reduce their risk over time. And we do this test within the first couple of weeks of someone starting Strength for Life. So this project's really about people who are not. We want to come in and see what your baseline results are, and then help you work through some exercise program to retest and hopefully get some great results at the end.
So someone has just asked quickly how much this costs and how they book in. I assume you'll cover the book in question.
Yeah, look, within the project, we've got funding to do 20 of those assessments for free. So I've actually done maybe 4 of them, and we're sort of really focusing on people who are not involved in Strength for Life at the moment, who are keen to get involved for about a 12-week period. So if you are outside of that, we're charging $35 for the assessment, and that includes, you know, me putting together all the results. And then when you come in to do the the assessments for Strength for Life anyway are anywhere between $45 and $85, depending on where you go. At COTA, we keep it at the lowest level because we really want to offer this as a service that is not necessarily for profit. It's just to, you know, pay the cost of the instructors and stuff. And then with the classes, I mean, the classes can be anywhere between $5 and $12 a class. So, and each provider, I've got a bit of information. Maybe if we move along a little bit, I've got a bit of information a bit later on, but the best thing to do is if, for example, you want to do the falls risk assessment at Hughes, we can give you the results and you can take that to the provider of your choice. You know, you might live on the north side and you prefer to do the classes over there. Well, you can take that with you and they will use that to put your program together. We, as a manager of Strength for Life, we cap the cost of the assessments and the classes, but then it's up to the individual providers to decide what they will charge. And that's for many different reasons. You might have a class with a physio where there are 5 people, and because that physio has a high level of education and the group classes are smaller, they might charge more money than coming to Hughes and doing a session with a personal trainer and within a group of about 15 people. We have a maximum of 15 people. How am I going with time, girls? Can you just tell me how much more time you'll give me?
You've got about 5 more minutes. That's
okay. I think Maureen and Gary have a question. Did you want to put your microphone or did you? No? No, all good? Is this done in the ACT or similar in Sydney? Yeah, in Sydney, where they're running the same program. We started off everyone as Strength for Life. They have rebranded it as Living Longer, Living Stronger. It's the same program. It's just New South Wales, Victoria and Tassie, Living Longer, Living Stronger. And then ACT, South Australia and Western Australia are Strength for Life. There are hundreds, probably thousands of providers across the country, which is fabulous, and they're growing. Yeah, so just a quick review. Strength for Life, it's evidence-based. It is for people over the age of 50. Obviously, if you're a COTA member or a seniors card member, you'll have a discounted rate in most locations. The instructors are accredited. We've got exercise physiologists, physios, personal trainers running the programs. And I think the key thing is that these programs are individualized. So you're talking, you know, somebody was saying, oh, I feel really sore after I exercise, or my knees and my back. And it's important that it is a progressive resistance training program, so that you start where you are and that over time we can evolve your program because you're getting stronger, and also taking into consideration the injuries you might have had in the past, your health condition now, how long since you've exercised. Look, if you haven't done anything for many, many years, you need to go in at a really easy level. You know, the best thing I think is when they come back to us and say, oh, can you make that a little bit harder for me because it's getting a bit easy. I'd rather that than someone saying, oh, that last class I couldn't get it out of my chair for 2 days because my legs were so sore. You know, so and the groups are really friendly. It's really interesting. I read a research study last week, and just the fact that you exercise within a group, there's an increase of, I think, 13%. We have 11% greater benefits are seen in group-based activities versus individual. And this is talking about falls prevention. And exercise in itself reduces the rate of falls by about 23%. So it's huge. It's not the only thing we need to do, but it's a big contributor. And when you think that 1 person in 3 over the age of 65 has a fall every year, that's massive. You know, look at the number of people we have here. There's a few people here that within the next year might have a fall and might have a serious fall. Oh, what was the quote? Oh, your parents are doing it and they love it, 82 and 93. Yeah, isn't that fabulous? And don't you love it? Because we're talking about fear. Sometimes fear comes from not enough confidence to do the day-to-day activities. And strength training can really help you feel a lot, you know, obviously stronger, but more confident in how you move your body. If you'd like to go to the next one, Robin, I think that's just a quick overview of, well, that's just fab, yeah. So these are the locations we have in the ACT. If you're interested, the tier 1 are the physios and the exercise physiologists. Tier 2 is the fitness professionals. So we're all personal trainers with a lot of experience as well. So if there are more complex conditions, that's probably best to go to a tier 1. And we often refer to tier 1 when we can kind of see that that's what that participant needs. And there's a list of the providers, but that's all on the website as well. You'll have their addresses and contact details, phone numbers, email addresses. So if you're keen to investigate a place that's close to where you are, please check out the website. And if we want to go down, because I'm sure I'm close to the end, just reinforcing that it's personalised, the exercise programs. And yeah, this one here, if you want to join the Strong Women for Life project, go back, yeah, or want more information about Strength for Life, please contact me, jot down that email address. You can visit COTA's website and go into the program section to look at Strength for Life. If you're coming into Strength for Life, you need to contact your GP or your other health professional for a referral, and then either book the Falls Risk Assessment or the Strength for Life assessment. Strength for Life assessment normally comes first, and then we would do the Falls Risk. But for example, Gary, if you wanted to do the Falls Risk assessment, just contact me and I'll book you in. Right, so I think I've spoken enough, but as you can see, falls is a huge topic, and we could probably spend an hour on it, but we might do that in a few months' time. So thank you, and I'll pass it back to you, Robin. And as I said, any comments, questions, pop them in the chat, and I'll hope to answer them at the end.
Thanks, Di. I think we'll have lots of good chat at the end in the Q&A session based on what was happening in the chat there. So we'll just hand over to Meg now, who's a wonderful dietitian who works alongside me at the Heart Foundation to give us a few healthy tips about nutrition. Thanks, Meg.
No worries. Thanks everybody for having us, and it's great to see so many people online and engaged, and continue the discussion in the chat in the background as well, and we can get through that today. So I've just got a few bits and pieces to get through now, and I thought I'd start this off with just a few kind of introductory type slides, just to give you a little bit of background. But then I thought I might take a bit of a question and answer approach to the rest of it and go through some of the key things that we get asked about a lot. So I'll go through those, but of course, if there's anything in addition to that you wanted to talk through, we can do that afterwards as well. So I might just get you to go to the next slide, Robin. So this is probably not quite as big as what I should have blown it up to on this slide, so I do apologise if it's a little bit tricky to read, but we'll go through it anyway and talk through it. But what this is, we call it at the Heart Foundation the Heart Healthy Eating Pattern, which is maybe a little bit of a more complicated name than what we need to call it, but this is really the groups of foods and the types of foods that we suggest you eat across your days and weeks to really make sure that you're filling your plates with foods that are going to be really healthy and nourishing and protective for not only your heart health, but your health, more broadly. And so I guess people might be looking at these little pictures now and seeing, fruit and vegetable and whole grains, and okay, it's not anything sort of too life-changing. It's not anything, beyond what we probably already know and talk about in terms of what an ideal diet looks like. But what we find is that unfortunately, the majority of Australians aren't eating, plates that look like this. And what we've actually found as well is that what's tending to happen is that we're filling a lot of our days with those discretionary foods that was mentioned in your surveys beforehand. So those sorts of junky foods or really, really processed packaged foods. And it's actually kind of, we're eating those things and it's pushing out all of these really, really nourishing foods. And when we relate that back to our health, we're finding that it's the lack of these really, really nourishing foods, it's the lack of those that's actually having the biggest impact on our health. So when we're looking at what we should be including, we know that it's sort of what we do all the time has the biggest impact on our health. So if you have birthday cake on your birthday and you go a bit crazy on that one day, that's kind of okay as long as that pattern doesn't continue. if most of your eating is really nourishing and healthy and bright and colourful like this picture, that's going to have the biggest impact on your health rather than what you might do on one day or one occasion. So it's really what's happening over time that has the biggest impact. So when we go through these, you know, the first one and probably the most important is that we have plenty of fruits, vegetables and whole grains. Again, it's not rocket science, but we just know that a lot of people aren't doing it. And one of my biggest tips would be that if we are going to get to that 5 serves of vegetables a day that we all strive for, it's really important that we include those veggies, you know, more than just in one meal. It's really hard to fit those 5 serves into one meal if you kind of wait until dinner to have your vegetables. It's really helpful to try and include, you know, some salad on a sandwich at lunch or just any sort of vegetables at your lunchtime meal as well. And it gets you much closer to that 5 serves in the day. Number 2 is around our proteins, and we're going to go into that in a little bit more detail because it's something that often gets brought up in the media. And it's really important. We've just been talking about falls, and protein is one of those foods that can really help you hold on to your muscle and your strength when you're getting older and help to reduce that risk of fall. So that one can be a really, really important one as you're getting later in life. Number 3, we'll also talk about in a little bit more detail, but it's all about our dairy, which is equally as important when it comes to falls because it has such a big role in our bone health. So particularly for any postmenopausal women out there, calcium's really, really important. So, and can be really vital in trying to offset some of the bone changes that tend to come with menopause. So we can certainly still include that within a heart healthy eating pattern, and milk, yogurt and cheese can be a really nourishing, nutritious thing to include. Number 4 there talks about our fats and oils. And so we certainly suggest things like olive oil, canola oil, nuts and seeds instead of, you know, butter, lard, dripping, those sorts of choices. And number 5 is around our herbs and spices. And some people will probably be aware that there is a bit of a link between salt and blood pressure. So we really do suggest that people use herbs and spices instead of relying on salt when it comes to flavouring your food. And sometimes we just have to be a little bit more creative and use extra pepper or garlic or onion or chili or, you know, herbs or lemon juice or something like that to flavour our food instead of, you know, sometimes we go into autopilot and we add salt when potentially there's another option. With that, I might move to the next slide, Robin, that kind of shows us how we might be able to put this all together on a plate. So if we look at the sort of the left-hand side of this, this slide at the moment, when we sort of look at those 5 different ideas or those 5 different groups of foods, it's helpful to sort of have in the back of your mind what kind of the proportions of each of those food groups we're looking for. And this is a really, really simplistic way of thinking about it, but I think it can, you know, really help to keep it quite practical. And so what we often talk about, and it's generally for lunch as well as dinner, is that we want to make sure that we've got kind of half a plate of vegetables. We really want to make sure that we've got lots of different colours there. And when we, you know, in your feedback, somebody mentioned anti-inflammatory type foods. And one of the biggest things that we can do to help with inflammation is to get lots of different colours in your eating, because that tends to mean that there's lots of different vitamins and minerals there. But it's also about getting lots of different foods and lots of variety across your week. And that tends to be the best way to get those properties through. It is definitely still an emerging area though. But we kind of need that half a plate of vegetables. We need, you know, about a quarter of a plate of either whole grains, or even that's where your potato or sweet potato or corn or something like that might come in. And then about a quarter of a plate of protein. So whether that be fish, chicken, eggs, nuts, seeds, beans, those sorts of things. And I've just popped in some of these other pictures of the cooked meals on the right-hand side, because I think this little healthy plate model, it's easy to visualize if you're having kind of a meat and 3 veg type meal, but sometimes it's a little bit harder to imagine it when it is, you know, a soup or something like that. But it's really just about having a bit of a think about the proportions and sort of checking, have I got more veggies here than I do meat? Okay, yep, that's really good. And have I got more veggies here than I do the grainy stuff? The grainy stuff's great, but we still want to have a bit more veggies than that. And then, of course, we can use some of our healthy fats and herbs and spices and that sort of thing for flavour as well. So hopefully that makes sense there. And all of these pictures on the right-hand side are Heart Foundation recipes. So we'll certainly forward on a link after this session to all of our recipes, because there's hundreds, I think, that can be a really good place to start. So in terms of meat, this is one of our big topics. It gets brought up in the media all the time, and it's something that's been quite topical. And so I just wanted to kind of highlight that when it comes to our protein foods, as we said, they're really important for that muscle, you know, maintaining muscle and maintaining strength. But variety and moderation is the key. Generally in Australia, we do eat enough protein. If anything, we probably eat more than what we need to. But sometimes as people get older and their appetite decreases a little bit, people find it a little bit harder to fit these foods in. But what we know is that some of our protein foods are a bit more protective for our heart than others. And that's what this little scale here is trying to show. And so we know that fish and legumes, so beans and chickpeas and that sort of thing, as well as nuts and seeds, they're actually really good for cholesterol levels and quite protective for your heart health. So we do certainly want to see you eating fish a couple of times a week, you know, adding lentils or chickpeas or kidney beans or something like that to meals is really, really healthy and really helpful. When we look at sort of our chicken and eggs, those poultry foods, they sort of work out to be neutral for your heart health. Huge benefit for your heart health, like what nuts and seafood and that sort of thing do, but they certainly don't harm us either. They're kind of a really good thing to include for variety. They won't give you a huge benefit, but they don't do anything wrong. So they're kind of a good in-between sort of food. With our red meat, we do want to try and limit that to sort of 1 to 3 times a week, and sort of limiting it to less than 400 grams a week. Because we do know that if we have those in excess, they can start to have some not so great benefits or not so great outcomes in terms of our heart health. That sort of deli meats and processed meats and bacon and ham and that sort of thing aren't on this table because they're really not great for our bowel health or our heart health either. On to the next sort of question that we've got here is about dairy. So we said, you know, great for bone health, absolutely. And with dairy, we've sort of changed it a little bit recently because, you know, milk, in fact, yogurt and cheese can be included in a heart healthy eating pattern really well. If you do have high cholesterol or if you have a history of heart disease, we do still suggest the reduced fat varieties. If you don't have high cholesterol or heart disease, you can sort of choose whether you want the reduced fat or the full fat varieties. Unfortunately, this doesn't extend to, you know, butter, ice cream and dessert. It's really about milk, yogurt and cheese. We'll go to the next one now. And I've just seen a couple of questions pop up, but I might get through these and then we'll chat about those in a minute if that works for everybody. So my next one was around eggs, because we get this question all the time. And I think the verdict on eggs has changed so much over the years that now everyone seems very confused. So we can tell you that the latest sort of science tells us that we absolutely can include eggs, that they're a really good protein food. They're cheap, they're easy, they take 2 seconds to cook, particularly if you're only cooking for 1 person or 2 people, it can be a really good option. With eggs, we do have a limit of 7 eggs a week. If existing heart disease or type 2 diabetes. And this is really just taking a cautionary sort of approach to make sure that it doesn't affect your cholesterol levels. But generally speaking, if you don't have any of those conditions, we really don't get strict on the amount of eggs that you eat, and you can eat in excess of 7 if you wish. So that's the verdict on eggs, which is a lot more lenient than what we've seen in the past, which I think is really, really positive, because I think we inadvertently scared a lot of people off eating the humble egg. I might move on to the next one now, Robin. Thank you. So butter, the $1 million question, hey? Butter is always the one that comes up. But unfortunately, we know that butter is not great for our cholesterol levels, and it tends to send our, not so helpful cholesterol levels through the roof. So I often talk about our helpful or our lousy cholesterol levels, because we've got 2 different types, and butter tends to increase your lousy cholesterol levels, which isn't so great. We do suggest swapping butter for kind of olive or canola oils, even avocado or some nut butters like peanut butter or something like that. Would be better for your cholesterol levels. Go to the next one. So sugar is the other big one that's in the media all the time. And generally speaking, if we're eating very similar to that pattern that we showed at the start with those 5 different groups, it'll be naturally really quite low in sugar anyway, and you don't have to be too concerned. What we often get asked about is sort of the sugar in fruit or the sugar in yogurt, for example, or something like that. But when we actually look at where most of the sugar in our diet is coming from, most of it comes from drinks. So soft drinks and fruit juices and sports drinks is where a lot of it comes in. And then after that, it sort of is cakes and muffins and biscuits and, chocolate bars and that sort of thing. And even when we look at sort of breakfast cereals or flavoured milks, which are pretty, high in that added sugar, they still don't add as much to our diet as some of those other foods. So if you don't drink too much soft drink or sports drink or fruit juice, and you don't have too many processed things, generally speaking, you probably don't need to worry too much about the sugar. And salt, I think, is one of my last big questions. And we know that there's a link between salt and blood pressure. So we are suggesting sort of looking at these processed meats here and trying to swap that over to like some leftover grilled meats or roast meat or something like that. Eggs on a sandwich instead of sort of ham or something like that. And even tuna can be a really good alternative. And equally, chips and biscuits and those sorts of things have a lot of hidden salt. So, some plain kind of Vita-Wheat type crackers can be a better option. Roasted nuts that don't have salt on them can be really tasty, or even like some freshly popped popcorn that you've made without the salt can sort of be a better alternative. So I'm running out of time, so I'm going to scooch through these practical tips for you all. But we are looking to, aim for 5 serves of veggies a day. So, just try and add them wherever you possibly can. Trying to go for the grainy versions of things. So grainy bread or brown rice or pasta and that sort of thing. Those products have gotten much better in the last few years, particularly things like whole grain pasta is way better now than it used to be. So they can be a really good option. Legumes like lentils and chickpeas and beans are a really good thing to include wherever you can. Fish we spoke about earlier, and one other idea is to have a meat-free day each week, and that can sort of just help to bring down that amount of red meat if you are eating a fair bit of it. I think I've got one more slide and then we better open up to questions. And that was just this whole idea that whether it be strength or nutrition or whatever it is, it's those really small things that we do consistently day in and day out that have the biggest impact on our health in general. It's very true for nutrition, but I'm sure Di would agree that it's very true for physical activity as well. So hopefully that's one thing that you can take away from today. Otherwise, I'm going to pass back to Robin to whiz you through this last little bit of extra supports, and we'll answer some questions.
Thanks, Meg. Just trying to start my video again, but it appears to have not want my video on. So I'll just talk while my video is coming back up. So really today, what we wanted to leave you with was some options for you. You know, we talk a lot about do this, do that, and here's some great advice. And we also just wanted to let you know as well that there's a bunch of free stuff, support-wise, that you can access. So, you know, if you think you might need a little bit of extra support with your mental health, or, you know, you want to talk to a professional, you can go to your GP and, you know, have an appointment with your GP, which should be bulk billed. The majority of them are bulk billed. And then you'll be able to get your GP to develop your mental health plan, which means that you'll be able to access bulk billed support through a psychologist. And I think you can get them once every year. And sorry, don't quote me on this stuff, but yeah, you can basically see, I think, a psychologist 5 times in that for that one mental health plan. There's also a chronic disease management plan. So again, go to your GP talking about a chronic disease. So it's something that is affecting you and is present for sort of at least 6 months. So that could be something like asthma, cancer, you know, heart disease, diabetes, arthritis, stroke. And they'll, you know, your GP will know, but just if you're aware that it's, you know, you might be eligible for these things, it's something that you can use to strike up a conversation with your GP again. So either that chronic disease management plan or like a team care arrangement plan is also available. Also in pharmacy, read medications, you've got meds checks that you can do in store that are free. You know, if you're on 6 or more meds and you just might want to, you know, have a little checkup, an annual checkup of what's going on, what you're taking. And then there's also the home meds review, but you need a referral from a GP to get that done. And again, you can very easily do that just by visiting your GP. Of course, as I spoke about last week, we've got the Heart Foundation walking programs, including the personalised walking programs. You've got everything that Di spoke about earlier, you know, and Meg talked about the Heart Foundation, the recipes that are also there available to sort of support you. So lots of different avenues. So I'd like to think that you go away from today with actually some tips and tricks that, you know, next time you go to your GP, or maybe you're logging onto the internet, you can have a look at some of these things. So I'm so sorry, I know we're out of time, but if you're happy to kind of stick around and answer, you know, talk through a few of the questions, we're very happy to stay on. Those of you that need to go, by all means, please, you know, log off. But there was a few really good questions in the chat box, so we might go through some of those. And I'll stop sharing my screen. If you want to keep your videos on or close them off, but I don't know, do you want to go through the questions in the chat box, or would you guys prefer to just fire away if you've got any questions? There was one about salt, Meg, just quickly, something along the lines of, should we be trying to just cut out salt altogether?
Yeah, no, look, I'm happy to take that one. So look, generally we don't advise that you need to eliminate salt entirely, and it's probably, you know, got to do with the fact that we do need a small amount of salt to keep ourselves well, and our body needs a certain amount of salt to function. But I guess what we tend to find is that Australians tend to eat sort of 2 to 3 times that amount. So we tend to eat it in significant excess to what our body actually needs. Generally, if we're eating a good variety of foods and we're eating lots of fruits and vegetables and that sort of thing, we'll naturally get the small amount of sodium that we actually need. So we don't necessarily say that you need to eliminate it entirely. What we do find is that generally about 80% of the salt that people eat comes from processed and packaged things. So if you're eating lots of, you know, packaged pasta sauces or biscuits or, you know, whatever it might be, anything that comes in a packet really, if you're eating a reasonable amount of that sort of stuff, that's where the bulk of your salt's going to be coming in. So it'll be coming from those processed and packaged foods more so than the amount of salt that you add at the table. So you know, that's always, if you are trying to drop your salt intake, it's always good to look at those processed and packaged foods as a first port of call. But if you tend to cook most of your food yourself and you're preparing it mostly yourself, then, you know, you can look at how much you're adding to your food, because that is something that you've got full control over and that you can modify as you see fit. Often when we're talking about salt, it's worth remembering that our taste buds adjust to salt over time. And so generally people might find that their food tastes a little bit strange for the first week or two, but then your taste buds adjust and you sort of get used to a new normal. So sometimes it's a bit of a game of perseverance. And there was something there about from Fiona about your poor mum who was quite unwell because her sodium levels were too low. And I'm sorry to hear about that. That doesn't sound, you know, that sounds like a horrible experience for all of you. Yeah, to reassure others, I think it is quite rare that that happens, but I hope that she's okay now and has recovered well enough.
Meg, there's something about protein shakes in here. Have you got any?
Yeah, I did see that one from Di in terms of protein shakes for older people. And it's probably a little bit of a personalised one, to be honest. But we do find sometimes as people get older, their appetite naturally drops off quite a bit. And so sometimes people find that they sort of start to lose weight unintentionally, or they're losing a bit of their strength because they're just not eating enough, because their appetite kind of isn't there to remind them. And for some of those people, protein shakes can be quite helpful because it can just be a little bit easier to drink some of your nutrition rather than necessarily needing to eat it. So it does depend on the people. Most of the time, they're probably not needed if you're eating kind of 3 good meals a day. But if you are struggling with that, then it can be a good idea. Yeah.
I loved Fiona's idea of putting all the leftover things in veggie bakes or veggie soups for lunch. Good idea.
Yeah,
good idea.
Absolutely.
And
Sounds very easy.
the other thing too is there was a question about fatigue, and obviously, you know, if it's unexplained fatigue, that's something to go to the GP about. But it can also be from maybe not having an adequate diet, not getting all the nutrition that your body needs. It could also be around our sleep patterns. If we're not sleeping enough, we know that also affects our risk of falling. If we're lacking the sleep, well, then we're fatigued and more likely to fall. Hydration is also a big thing, you know, is being able to drink enough water each day. When we don't drink enough water, for a lot of people, they can feel unwell, they can have headaches, and also as far as exercising is concerned, it's more beneficial for us if we've got a well-hydrated body to exercise. And then the fatigue can also be associated with the fact that if you're inactive, it's nearly like a cycle, you know, the less you do, the less you want to do because you're tired. But often that fatigue can come from the fact that you're not exercising. So getting back into a simple exercise routine, doing something on a regular basis, can actually increase our energy levels. So we're less fatigued. We get through our day, you know, doing the same activities, but not feeling exhausted at the end. Any other questions? Who's the lovely Catherine down the bottom with a little pretty girl?
Meg, did you see the couple of questions there about water and anti-cramping tablets such as magnesium?
Yes. So, so in terms of how much water should you drink, generally, you know, the 8 glasses a day is still the amount that we're mentioning, that we recommend. So, you know, getting close to 1.5 litres, 2 litres a day. Generally, without being too crude, but your urine's generally a pretty good indicator. So, you know, light yellow colouring, unless you've been told for any reason to limit your fluid. If not, kind of a couple of litres a day. And obviously in the hot weather, we'll probably need more. In terms of magnesium for cramping and that sort of thing, to be honest, I think the verdict is still out a little bit. It's quite a common thing that gets recommended, magnesium for cramping, and it can be a little bit hit and miss. Some people find that there's a benefit, other people less so. One thing you do need to be mindful of, and again, without being too crude, is that taking magnesium tablets can cause a bit of bowel upset. And so some people do experience sort of diarrhea and can then get dehydrated from that. And dehydration can cause cramping. So it can be a little bit of a spiral in some cases, but it's not something that we recommend to everybody all the time, but you can certainly get your magnesium levels checked and see whether or not, if you are low, then potentially replacing it can help. But probably a bit individual.
Meg, I've just unmuted. It's Donna here. Yeah, my dad's just come back out of hospital with another bout of pneumonia.
I'm sorry.
I didn't realise the magnesium tablets created the diarrhea. So he's having the cramping, he's not drinking enough water and all that sort of stuff, which means he's had urinary tract infections, and then it ends up in his lungs, because there's something about the body. If you're getting urinary tract infections, what do you know that connection? And how much magnesium tablets are bad? Because I didn't realise there was that connection with the diarrhea.
Yeah, look, in your dad's case, it's probably a little bit hard to say, to be honest, Donna, because it sounds like there's a few bits and pieces going on, so it's probably a little bit tricky for us to say. So yeah, it's probably a bit hard to really indicate, to be perfectly honest. But I hope he's feeling better shortly and they're able to get on top of it. But it's probably worth chatting to his GP about it so that they can look at all of it, because it could be the magnesium, but potentially it could be something else as well. So or another medication or something like that. So yeah.
It's tricky, and we're low blood pressure people in my family.
And
if we don't drink water, we also get dizzy and fall over.
Yeah,
and get the blood out, and he's got to have a weekly blood test, and trying to get enough water in him is hard. Thank you.
Yeah, absolutely. I'm mindful of time, Robin, so I'm wondering whether or not we maybe can potentially respond to some of these, in some of the information that we send out afterwards, perhaps.
Yeah, that sounds really good. Thanks, everyone. I think we covered all the questions that were in the chat, and Di's had to duck off to do some Strength for Life stuff, I think. So what we'll do after this, obviously we'll send out a recording of this. Oh no, someone asked about intermittent fasting. Okay, we'll make sure we cover that when we send out the information after the session. So there will be a survey that will follow up, just asking a couple of questions about this. And we'll send you, each of the presenters will send you our 3 kind of key takeaways from each of our presentations. So hopefully that'll, leave you with 3 of the, more important things that you should be, trying to look at doing. But thank you so much for coming along. And obviously you've got my details, and Di's details, I think, was CC'd to the email as well. So yeah, thank you. Have a lovely afternoon.